Hi, welcome back to my channel. This is Dr. Oye. So today we are going to be talking about something very common, and that is kidney stone. What do you know about kidney stone? How common is kidney stone? But before I start, I would like to tell us this story. A lady walked into my office one day and she was complaining about severe back pain. Just one side. I asked her to do some investigation. We have a wonderful diagnostic center here in the city of Oka, Clinics Healthcare, one of the best in Southeast. So she came around, she did several tests, and when it came out, we noticed she had kidney stone. That was what I was suspecting. The size of the stone was just small, so I advised her on what to do. Then after 2 weeks, I've even forgotten I sent somebody to do another test after 2 weeks. So after 2 weeks, she came into my office with the test result dancing. I was like, what's happening? She was like, you remember me? You asked me to do this, do this, do this, and redo a scan. I've done the scan, and there's no trace of stone. She was so happy. I was happy too. One thing about doctors is that we are so happy when our patients are fine. We want to discuss kidney stone. What are the things you need to know about kidney stone? Kidney stones are hard deposits found within your kidneys. They are made up of minerals, salts that clumped together to form stone. And what are the components? What can form stone? We have calcium stone, okay? We have struvite stone, we have cystine stone, we have uric acid stone. But the commonest form is the calcium. We have calcium oxalate stone. So what can cause this stone? The first thing is dehydration. Dehydration can cause kidney stone. How often do you even take water? Do you wait till you are thirsty before you take water? So if you're not drinking water, you're not doing yourself any good. You are creating an environment for stone formation. And the funny thing is that when eventually you get the stones, that water you are avoiding, you will have to drink it. Avoid dehydration so that you don't get stones. Okay. Then the next thing on my list, vitamin C abuse. I've seen children come down with stones because mothers are giving them vitamin C. Studies have shown that vitamin C can cause kidney stone. So why bombard yourself with vitamin C? Take vitamin C only when it is prescribed. Stop abusing it. Okay? Another cause of kidney stone is taking diet that is rich in sodium, sugar, and all these animal protein. So try as much as possible to limit salt intake. Don't add salt to table. When you've cooked and you've prepared that wonderful meal and you noticed that the salt is not enough. Don't add salt to table. Limit your salt intake. The next thing that you want to work on is your weight. Obesity has been linked to kidney stone, so reduce your weight. Recurrent urinary tract infection can cause the type of stone we call struvite stone. There are some organisms that can cause urinary tract infection that can cause kidney stones. For example, when you have Klebsiella, when you have Proteus mirabilis, they are urease positive organism, okay? So when they cause urinary tract infection, most times, especially when it is recurrent and you don't treat them on time, they can cause conversion of urea to ammonia, okay? So what would this ammonia do? It will cause alkalinization of the urine, and when your urine is alkalinized, it can cause struvite stones. So prompt treatment of urinary tract infection. Don't just get drug and start taking. Make sure you do a culture and to know the organism and the drug that is susceptible to and treat it properly and promptly. All right. So the next thing I would want to talk about, I think I've exhausted the causes of kidney stones. I've talked about dehydration, not taking enough water. I've talked about medicine abuse like vitamin C overuse. I've talked about excessive intake of sodium, sugary products. I've talked about recurrent urinary tract infection if you keep having it. Then uric acid. Some persons with gout, there's what we call gout in medicine. So person with gout might end up with uric acid because of the deposition it can form crystals within the kidney, and then it can predispose them to having kidney stones. Then we also have cystic stone. This cystic stone is more of hereditary condition. So we also have family history. You know, everything, most things are tied to family. So if you have a family member, a family history of kidney stone, there is a tendency for you to develop kidney stones. Okay, so that's all about causes of kidney stones. Now let's talk about the symptoms you would have if you're having kidney stone. The first symptom that bring people to the hospital is pain. This pain can either be the two sides if there are stones on both sides, or it can be one side. So most times people present with one-sided pain, just know that it's one side, but we still scan both kidneys. Then the next thing people might present with is hematuria, blood in the urine. Be like, my urine is reddish in color. Kidney stones can also present with hematuria, but most times the commonest presentation is pain. One thing about the pain that comes with kidney stone is that sometimes when it's obstructed, whichever position you try to move, you will still be feeling the pain. How do we diagnose kidney stone? Just do urinalysis and also do an ultrasound scan. Okay, urinalysis, you're looking out for blood, any trace of blood in the urine, and also you can even see some calcium oxalates in the urine. Ultrasound scan, that's the first line imaging for kidney stone, but CT scan is the best diagnostics tool for stone. The next thing we'll talk about is how do you treat kidney stone. The truth is that kidney stones are handled based on the size. So if the size of the stone is small, most times we advise the patient to take a lot of water. And once they take a lot of water, the stones get flushed out. You can be given pain medications for the pain and some medication that can calm it down. Then, but if the size is large, a urologist would decide the procedure to carry out. Whatever procedure he decides to use on you to take out the stone. Okay. Then, what are the complications of kidney stones? When the stone is big or even small stones, they can actually obstruct the outflow of urine from the kidney, and this will cause the urine to be retained in the kidney, and it will lead to a condition we call hydronephrosis. And hydronephrosis can cause kidney failure. Then the next thing you need to know is how to prevent this kidney stone. They say prevention is better than cure, right? So first, drink a lot of water. If you don't get anything from this video, get this, please. Take enough water. Eat food rich in fruits, vegetables. Try to lose weight. Okay, reduce salt intake, reduce high protein intake, live healthy, treat urinary tract infection promptly. This video is just for knowledge and would never replace your doctor's advice, so always visit your doctor before you take any decision. If this video has helped you, don't just watch it. Like, comment, and subscribe so that you join this community. God bless you. Bye.